The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan, and it's a pleasure to be hosting the podcast. And thanks to everyone for listening in. This should probably be a pretty short podcast this week. We are talking about the Centers for Medicare and Medicaid Services Office of the Actuary announcement of their national healthcare expenditure data for 2023. This is one of my Christmas traditions where I write and podcast about the release of CMS's NHED data. And this basically is released in the middle of December each year for the prior year. So we're at the end of 24. We're finally getting the national healthcare expenditures for 23. Why does it take so long? Well, it literally takes CMS about a year to capture, calculate, and categorize all the data for a year, given the size and labyrinthine complexity of our healthcare system. Each year as well, usually in the first half of June, the CMS actuary updates healthcare spending projections for 10 out years. So I spend a great deal of time analyzing the results in December as well as the forecasts in June. And so you're getting a look at that today here. Why is this so important? Well, first, it is the main comprehensive source of data for calculating the history and future of healthcare spending. Most other studies rely in some form or another on the CMS actuary's NHED reports. Second, it is a treasure trove of data that helps explain the inner workings of the healthcare system. Here you will find data by line of business, by service type, by source of payment, and much, much more. Last, since it calculates the amount of gross domestic product devoted to healthcare spending each year, it is the official statistic for how we are performing on the cost side against other developed nations. Before we get into the specifics, in 2022, we saw the percentage of GDP devoted to healthcare decline, which was tied to the anomalies of federal COVID appropriations and spending over a few years, principally in 20 and 21. But the fact remains that America is a huge outlier in terms of healthcare spending in the developed world. I usually say that the United States spends anywhere from 33% to 100% more than other developed nations. This continues to hold true despite the decline reported by the CMS actuary. And as I often say too, the value in the U.S. system is abominable. We spend the most by far of any developed nation, yet we rank dead last in terms of outcomes on a recent Commonwealth Fund study. It is not just that we are dead last, but that we are a quality outlier even against the lowest performing developed nations in the study. If you haven't read it yet, see my September 23rd, 2024 blog at the blog tab of this site for complete details. In addition, my book, The Healthcare Labyrinth, which is available for purchase via healthcarelabyrinth.com, goes into detail about why we are so dysfunctional using the NHED reports and how we can close the gaps on costs and outcomes. Well, we're going to take our normal 3 breaks for this podcast. Again, we're going to take our first break now. And when we come back, we'll get into the findings from the CMS actuary for healthcare expenditures in 2023. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back from our first break, and we're talking about the CMS actuaries' release recently of the national healthcare expenditure data for 2023. As I pointed out before the break, this is sort of the gospel on which all other financial analyses looking at healthcare really must rely on. So let's get to the findings now and dig into the numbers for the 2023 NHED. Again, all the details can be found on the CMS site. You can go to my blog on December 23, 2024 for that link. As well, the Peterson Kaiser Family Foundation Health System Tracker just released a National Health Spending Explorer, which really nicely tracks national healthcare expenditures since 1960. It is also based, of course, on the CMS actuary data. You can find that too on my 1223 blog at the healthcarelabyrinth.com blog tab as well. So here are some NHED findings for 2023. First, total national healthcare expenditures grew by $342 billion from 2022 to 2023, compared with just $198 billion from 21 to 22. The 2023 expenditures were $4.867 trillion for the year. What's really interesting about this almost $4.9 trillion number is that if the healthcare system of the United States was its own nation's gross domestic product, it would literally rank third in the world now. So number two, U.S. healthcare spending grew 7.5% from 2022 to 2023, compared with 4.6% from 21 to 22 and 4.2% from 2020 to 2021. Growth in 2023 was up considerably from 21 and 22. It is clear we are now in years of accelerated utilization and at least some inflation coming out of the COVID years. Number three, the share of gross domestic product, which is the way we measure the size of our economy, devoted to healthcare rose to 17.6% in 2023, compared with 17.4% in 2022. This represents our customary high range for the share of GDP devoted to healthcare. It is lower than the 19.5% in 2020 and 18.3% in 2021. But those years had major government spending due to the COVID pandemic that went into the healthcare expenditure calculation. And we also saw our economy shrink then too. So we saw in 2020 and 2021, the percentage of GDP go even greater, but we're back to about a mid 17% range in terms of gross domestic product represented by healthcare costs. Number four, the acceleration in healthcare spending growth reflected growth largely in non-price factors, such as the use and intensity of services in the healthcare system. When adjusted for healthcare price inflation, as measured by what is known as the National Health Expenditure Deflator, real healthcare spending increased 4.4% in 2023, higher than the 1.4% in 22, and higher than the growth rate of real gross domestic product, which was 2.9% in 2023. This makes sense as there was clearly pent-up service demand coming out of the COVID pandemic. We had very low healthcare utilization in 20 and 21. In 2022, we started to recover a bit. People started to want to go back and see the doctor and get all of their testing and things like that. And clearly in 23, we went even farther back, almost to a normal state. So that's one of the reasons that the growth was really dominated by non-price factors, really utilization of services. Next, we have number 5 here. In 2023, private health insurance and Medicare spending grew faster than in 2022, while Medicaid spending and enrollment growth slowed as the COVID-19 public health emergency ended and some enrollment was shed from the program with the return of redeterminations during the so-called unwinding. Number 6, we also saw a historic high of 92.5% insured, up from 92% in 2022. This occurred despite the slowing of Medicaid enrollment growth, as I just mentioned. Much of the increase in coverage occurred in the exchanges. Still, a rough 8% uninsured rate remains a huge crisis for America when the rest of the developed world averages a 1% uninsured rate. And this exchange growth is at risk if the enhanced premium subsidies expire at the end of 2025. Number 7, hospital care represented 31% of total healthcare expenditures in 2023. Spending for hospital care increased 10.4% in 2023 and reached $1.5 trillion. This rate of growth was the fastest since 1990. Again, this was due to the pent-up demand post-COVID pandemic. The use of and intensity of hospital services surged. Both inpatient and outpatient hospital care went up dramatically. With those first 7 points about national healthcare expenditures in 2023, we'll take our next break and we'll come back to continue along and tell you a little more. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the CMS actuaries announcement of 2023 national healthcare expenditures. We've talked about 7 points. We're going to sum up of the analysis of the actuaries report with another 7 points here. So number 8, spending for physician and clinical services, one of the other categories in the report, increased 7.4% to $978 billion in 2023, which was faster than the growth rate of 4.6% in 2022. Again, the use and intensity of services was responsible for the surge. Number 9, retail prescription drug spending increased 11.4% to $449.7 billion in 2023, accelerating from a rate of 7.8% in 2022. We are seeing hugely robust increases in both retail prescription drugs and in hospital care. And these two areas tend to compete for the highest rates of growth year to year. The faster retail prescription drug growth was experienced by both private health insurance spending, which grew 13.8% in 23 following an increase 3.5% in 22, and Medicare spending on drugs, which increased 12.2% in 2023 after 9% growth in 2022. The rapid growth in spending for drugs used to treat diabetes and obesity, especially those GLP-1 drugs, which are very expensive, contributed to faster overall growth in retail prescription drug expenditures. Number 10, private health insurance represented about 30% share of expenditures. Spending for private health insurance reached $1.5 trillion in 2023 and increased 11.5%. The robust growth in 2023 was driven by increased enrollment in the exchanges and employer-sponsored health insurance, strong spending growth for services, and strong growth in the net cost of insurance. In 2023, enrollment in private health insurance increased 1.6%, or 3.3 million individuals. Number 11, Medicare represented a 21% share of expenditures. Medicare spending reached $1 trillion in 2023, increasing 8.1%, following a 6.4% growth in 2022. A turnaround in traditional Medicare fee-for-service spending growth from a decline of 1.4% in 22 to an increase of 1.7% in 2023 drove the faster growth in Medicare. Medicare Advantage private plan spending growth remained strong, increasing 14.7% in 2023, following 15.7% growth in 2022. Total Medicare enrollment grew 2.1% in 2023. Number 12, Medicaid represented an 18% share of expenditures of healthcare in 2023. Medicaid spending increased 7.9% to $871.7 billion in 23, a slower growth rate than in 22, which was 9.7%, in 21, which was 9.5%. In 2023, average Medicaid enrollment slowed dramatically, increasing just 0.8% from 7.5% in 2022, and it reached 91.7 million even as states resumed the redetermination of Medicaid eligibility. Number 13, total out-of-pocket spending increased by 7.2% in 2023 to $505.7 billion, a slight acceleration from growth of 6.9% in 2022. That shows the cost crunch the American public sees every day. Let's hit our final point, number 14. Government health insurance expenditures have surged over the past few decades and have become the largest source of healthcare funding. If you take a look at just Medicare and Medicaid and put them together over the last several years, they have clearly exceeded the amount of spending on private or employer-based insurance. So with that, we've sort of covered all of the major findings in the NHED for 2023 from the CMS actuary. We'll take our last break now, and we'll come back to just have some conclusions and some observations. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the CMS actuary's release of the 2023 national healthcare expenditures data. So we promised just to sort of sum up some observations. So what does this all mean here? Well, we are seeing a robust return of utilization in the healthcare sector post the COVID pandemic. Because prices are not controlled in our healthcare system and value-based care is still in its infancy, such robust utilization will continue to drive healthcare spending up each year and eat up more and more of economic output. I also suspect we will see rising inflation in the healthcare sector, which will add to the costs as well. Drug prices and utilization will also play a key role in driving up costs even more. The CMS actuary will update predictions for the long term in June 2025. In June 2024, the CMS actuary projected healthcare spending would be $4.799 trillion in 2023. It came in at $4.867 trillion, a $68 billion difference. At the time, the CMS actuary said healthcare spending would grow to $7.705 trillion by 2032. Using actual 2023 expenditures, that is a growth of 58.3% in 9 years, or 6.5% on average. Using the original 2023 estimate, that is a growth of 60.6%, or 6.7% on average. Healthcare spending would represent 19.7% of gross domestic product in 2032. Roughly that 1/5 magic number we are very worried about. So without major reform, we are faced with a few problems. Number one, while some healthcare spending can be deemed good spend, the reality is most of it is not, and healthcare will crowd out economic growth and constrain business growth. Number two, more Americans will become uninsured and underinsured. The CMS actuary says the number of uninsured will grow from 24.9 million in 2023 to 32.8 million in 2032. Healthcare, number three, will become more and more unaffordable. Out-of-pocket costs are expected to grow from $506 billion in 2023 to $749 billion in 2032, a 48% increase. While this is less than the 58 to 61% expected overall growth in healthcare, it is clear that real wages won't increase that much over time. In the end, healthcare reform is a must for America. As I say in the Healthcare Labyrinth, the three keys are affordable universal coverage, a pivot to care management, wellness, and prevention, and price reform. It's high time that Congress get together on a bipartisan basis to tackle healthcare reform, or we literally will have unaffordability become that much worse in healthcare than it is today. With that, we will conclude this episode of the Healthcare Labyrinth podcast. See you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.